right, I've gathered my materials. I've checked my chart.
Hello.
Hi, how are you?
Good, how are you?
I'm wonderful, thank you. My name is Jake. I'm a student nurse. Today we're going to be doing a physical assessment on you. All right, here's my consent form. All right, I'm going to go ahead and provide us with some privacy. And then I'm going to wash my hands real quick. All right, go ahead and say your full name and your date of birth, please.
Holly Cole, December 18th, 96.
All right, and previously to entering, I went ahead and checked her health history and I went and looked through that. All right, so I'm looking at her overall appearance. She looks pretty great. She's very symmetrical. Her skin looks like it's very healthy and everything. She seems to know where she is. I'm gonna go ahead and take your vitals right quick. All right. All right, 98.8. That seems right. All right, give me your index finger, please. All right, 98% is your oxygen saturation levels. I'm gonna go ahead and do your pulse real quick, your beats per minute. Can I see that real quick? All right. All right, I would have waited 1 minute, and it looks like her pulse is 77, which is in defined limits, and her respiratory rate is 14, which is also in defined limits. And we're gonna go ahead and take your blood pressure. Go ahead and hold your arm out, please. All right. Is that too tight at all?
No.
All right. Can you go ahead and hold that dial for me? All right. I'm going to go ahead and get a baseline real quick. Okay. All right. All right, it looks like your blood pressure is 118 over 79.
Okay.
All right, I'm looking at her. She seems oriented on the questions that she's responding to. Do you know where you are?
Yeah, I'm at Germana Community College.
All right, do you know what you're here for?
Yeah, I'm studying and taking a physical assessment.
All right, you know what time it is?
Yeah, it's about 3:30.
Yep, all right, sounds good. All right, I'm looking at her now with the questions she's answered. Because her LOC seems good, I'm not going to need to do a mini mental test, and I'm not going to have to use the Glasgow Coma scale either. All right, so I'm going to go ahead and test your strengths real quick. So
Okay.
Push against my hands, push, 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 push. All right, now I want you to pull against my hands. All right, wonderful. Now squeeze, 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 squeeze. All right, go ahead and separate your feet. Go ahead and push up against my hands. All right, now push down. All right, wonderful. I'm gonna go ahead and wash my hands after doing that. All right, and so the different cranial nerves that we're gonna be going over today is gonna be the olfactory, which helps with the smell, and then the optic, which controls the optic fundus, and then you have the oculomotor, which is eye movement, and then we also have the trochlear, which is also eye movement as well, and then you have your trigeminal, which has to do with your facial movements and everything like that, and then we have our abducens, which is eye movements laterally into the sides, and then you have the facial, which is facial as well, and then you have your acoustic or vestibulocochlear nerve, which is for hearing, and then we have our glossopharyngeal, which helps you swallow, and then the vagus, which is your gag reflex, and then you have your accessory spinal nerve that helps you shrug and head movements as well. And then the last one is the hypoglossal, which helps you stick your tongue out. All right, so we're gonna go ahead and move on with the physical exam. I'm gonna go ahead and wash my hands real quick. I'm gonna put on some gloves. All right, so what I'm gonna be doing is I'm gonna be palpating your scalp for any bumps or lumps or anything like that. And I want you to, if you feel any pain or discomfort, please let me know.
Okay.
Sorry, my hands are very sweaty.
That's awesome.
All right, so I'm gonna run my fingers through your hair. Can you go ahead and lean forward a little bit? All right. All right. Everything seemed good. Did you feel any pain at all while doing so?
No.
All right, so I'm gonna go ahead and feel the temporal pulse. All right, I can feel those. I'm gonna go ahead and touch your sinuses. So, all right. Your frontal sinus, do you feel any pain or discomfort?
No.
Now we're going to the ethmoid, maxillary. Any pain or discomfort or anything?
No.
All right, so now we're gonna move on to the eyes. So I'm gonna go ahead and pull down here and pull up. And I'm just gonna look to see if there's any redness or discoloration or, all right, or discharge. There's no drainage or discharge or anything like that. It's nice and pink, which is fantastic. Okay, awesome. And the position and alignment of your eyes seems good. Now we're just going to test your pupillary response to different things. So I'm going to shine this in your eye. It's a little bright, but I'm just testing your. All right. They're both reactive, responsive, and sensitive to light, and they are accommodating of each other. All right. Also, now what I want you to do is we're going to test your different cardinal fields. So can you go ahead and follow me? Okay. All right. All right, that seemed good. Everything seemed to be working and functional in that aspect. All right, now I'm going to go ahead and I'm going to take the ophthalmoscope, and we're going to go ahead and look in your eyes.
Okay.
All right, just to let you know, this is rather bright.
Okay.
We're looking to see if your ocular fundus is up and moving and working right.
Okay.
All right. We're going to make sure this is on 0. Just look straight ahead for me, please. All right. Everything's a nice yellowish pink color, which is fantastic. So we're going to go ahead and look at the other one. Switch hands. We're going to go in. Awesome. Another wonderful, great yellowish red color. So everything seems to be fine or anything like that. All right. When was the last time you had an eye exam?
About 2 months ago.
2 months ago, all right. So we're not going to do the Snellen chart test today. And also I noticed you had no nystagmus, which is shaking of the eyes or anything like that. I noticed your eyes were very steady, which is fantastic. And no lid lag. Do you wear glasses or contacts or anything of the such?
No.
All right. It sounds like you have wonderful vision. We're going to go ahead and move on to the ears. So I'm just going to move your hair out of the way. All right. Please let me know if you experience any pain. I'm going to go ahead and pull up on the auricle and palpate that. Any pain or discomfort? All right, I'm going to go ahead and discard my gloves. All right, now we're going to use the otoscope. And what this does is this just allows me to look in your ear to make sure there's no discoloration of your tympanic membrane.
Okay.
It should be a nice gray color. I'm just going to pull up on the helix, and I'm just going to take a look. All right. Pull up. All right, nice white gray color, which is fantastic. So that's all nice and healthy. All right, so next I'm gonna do the whisper test. So what I'm gonna do is, I'm gonna have you cover your right ear,
Okay.
and then I'm gonna stand behind you and I'm gonna whisper a word, and I'm gonna want you to repeat that word.
Okay.
Lemons.
Lemons.
All right, now go ahead and do the other thing with the other ear. Chocolate.
Chocolate.
Awesome, wonderful, you're doing real great. Okay, so now we're gonna test your sense of smell. I'm gonna need you to close your eyes. All right. What do you smell?
Hand sanitizer.
Yep, that's awesome. So your sense of smell is great. So I'm gonna go ahead and look at the symmetry of your nose, and I'm gonna go ahead and use the light. So can you tilt your head back up? I'm gonna lightly pull up on your nose. All right, I see you don't have any deviated septum or anything like that. Color seems great, fantastic, no drainage, no excessive amount of snot or anything like that. All right, we're on to the mouth, and so what I'm gonna want you to do is, your lip color looks great and everything. Nice, moist, no cracking or ulcers or anything of the such. All right, so I'm gonna go ahead and ask you to open your mouth, stick your tongue out, say ah, 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 ah. All right, your oral membrane looks fantastic. It doesn't look like you have any cavities, which is great. Can you move your tongue side to side, please? All right, other side. All right, so you don't have any cavities or anything like that. And your gums looked great too, so that's wonderful. All right, I'm gonna go ahead and use the tongue depressor. So what I'm gonna do is, I'm gonna look at your gag reflex as well, and I'm also gonna just push your tongue down so I can take a nice look at the pharynx in the back of your throat. All right, say sorry about that. All right. Everything looks good. No drainage, no excessive redness, bleeding, or anything like that, so that's great. All right. So now I'm gonna go ahead and palpate your neck, and I want you to, what I want you to do is swallow for me. All right, swallow one more time. Okay, when's the last time you went to the dentist?
A week ago.
Okay, that's awesome. And how often do you brush and floss?
I brushed my teeth twice a day and floss once a day.
All right, so now we're gonna go ahead and look at your lymph nodes.
Okay.
Okay, so what I'm gonna do is I'm just gonna feel around your neck.
Okay.
Make sure there's no swelling or anything like that of your lymph nodes. Please let me know if you have any discomfort or pain as I'm going through your neck.
No discomfort, no pain.
All right, that's wonderful. All right, so I'm gonna go ahead and check your thyroid. So I'm gonna reach around behind. Okay, everything looks great right there around your neck. All right, so now I'm gonna check your carotid pulse real quick. All right, now we're gonna do the other one. All right, that seems really good. Everything seems good so far. So now I'm gonna go ahead and look at your skin. I see there's no lesions, abrasions. You're warm, which is great. There's no excessive coolness or redness. The texture seems very good. Can I see your hand, please? I'm gonna test the turner of your skin, which is the elasticity of your skin and how quickly it snaps back. All right, that's great. And I'm gonna go ahead and I'm assessing you for edema. There's no excessive swelling. Can you go ahead and separate your ankles, please? All right, everything seems good with that. All right, and can you hold your hands out? I'm gonna check your capillary refill. Hands look great. I see there's no clubbing, so we're gonna do. All right, I'm gonna wash my hands. I'm gonna put on. After I put on this glove, I'm gonna check your armpits for me. So can you go ahead and lift up your left arm? All right. All right, another. Can you lift that one up for me? Thank you. All right. Fantastic. I'm gonna go ahead and wash my hands again. All right, so for respiration, okay, we're gonna go ahead and look at your different breathing expansions and stuff like that. So I'm gonna look at your chest expansion with you breathe. So I'm gonna put my hands on the back of your chest, and I'm gonna want you to take a nice, big, deep breath. Awesome, wonderful. And can you do it for me one more time, please? All right, did you have any phlegm or sputum in your throat, feeling the need to cough at all?
No.
All right, are you ever have any shortness of breath or anything like that?
No.
All right, wonderful. All right, so next we're gonna go ahead and listen to your different breath sounds and stuff like that.
Okay.
All right. Go ahead and say the word 99.
99.
One more time.
99.
All right, I'm gonna have you say the same thing 2 more times.
99.
And again.
99.
And again.
99.
1 more time.
99.
All right, wonderful. So next we're gonna do percussion and resonance.
Okay.
So can you go ahead and lay down for me?
Yeah.
All right. You may feel a little bit of discomfort. Can you go ahead and lift your shirt up for me?
Yeah.
All right, you can go ahead and sit up. All right, now I'm gonna listen to your different breath sounds.
Okay.
All right, we have your vesicular, and vesicular.
Okay.
Okay, we're gonna do bronchial. So, go ahead and take a deep breath. Breathe. Again. All right, go ahead and lift your shirt up right underneath your breast for me, please. One more time. Okay, I'm gonna go ahead and listen to your back. Deep breath. Deep breath. All right. So it sounds like there's no wheezes, crackles, or bronchi, or any adventitious breath sounds, which is fantastic. So that means your lungs seem very healthy. Do you smoke at all?
No.
All right, that's good to hear. We're gonna go ahead and move on to the cardiac part of the physical examination. So I'm gonna go ahead and listen to your heart.
Okay.
All right. If you could go ahead and lie down for me. All right. Can you go ahead and lift your shirt up, please? All right, can you sit up for me? And I'm gonna listen to the back one more time to listen for your heart. All right. And what I just did was I listened to your aortic, your pulmonic, tricuspid, mitral, and PMI, and your apical pulse when I did that little assessment, and everything seemed great. You had your S1 and S2 sounds, which are the lub-dub sounds that your heart makes when it beats.
Okay.
And there weren't any murmurs, or I didn't hear S3 or S4 or anything like that. All right, so I'm gonna go ahead and listen to your carotid one more time.
Okay.
Make sure everything's normal, flowing through there. All right, I didn't notice any bruit or anything like that, so that's fantastic. So we're just gonna go ahead and listen, feel your different pulses, okay?
Okay.
Okay, go ahead and put both hands out like this. All right, so right now I'm gonna listen, feel your ulnar, radial. Now we're moving on to your bronchial. All right, and I already did your carotid and your apical, but if you could go ahead and lay down for me, I'm gonna listen. I'm gonna feel for your femoral pulses. All right, wonderful. And we're gonna go ahead and do your tibial underneath. Can you go ahead and lift up? All right, we're gonna do your posterior tibial, and then we're gonna do your dorsalis pedis. All right, you can go ahead and sit up. And as I was doing that, I was assessing, I didn't see any abnormal swelling or edema or anything like that, so you seem like you're good to go. That completes our physical examination for today.
Okay.
And what I would then do is I would document everything. I would make sure I write down all the specific things that happened today. And thank you.